My name is Dr. Melinda Whitaker, and this presentation is on low-stress handling of cats. Low-stress handling is a way to handle cats in a veterinary setting while minimizing stress. Low-stress handling utilizes a basic knowledge of normal feline behaviors. Low-stress handling is important in veterinary and shelter medicine because it helps to give cats the best possible medical and social outcomes. When cats feel safe and secure, many challenges of handling subside or disappear altogether. Low-stress handling starts at the intake area. If possible, a shelter should have separate areas for dogs and cats. Ideally, the intake area should also be separate from the area where pets are being adopted and reclaimed. Upon arrival at an animal shelter or veterinary hospital, cats are bombarded with an unfamiliar, uncomfortable, and frightening environment that is filled with an overwhelming number of sights, sounds, and odors. Cats have heightened senses of smell, hearing, and vision, as well as an increased sensitivity to tactile stimulation, so everything they experience is more intense. This photo illustrates some of the differences in cats. They can hear frequencies at 65 cycles per second and move their ears independently. They have twice as many smell-sensitive cells as humans and have better peripheral vision than we do. They also have highly mobile, highly sensitive whiskers that allow them to detect anything that moves their whiskers the tiniest distance. In a veterinary or shelter setting, we need to make sure to manage odors by cleaning surfaces, washing hands, removing lint, and ventilating the area after olfactory incidents. Cat behavior is driven by smell, and some odors, air fresheners, blood, alcohol, deodorant, and perfume may actually increase anxiety. Low-stress handling helps avoid overstimulation. If we, as veterinary professionals, can anticipate stress and recognize fear, we can minimize the stress of handling. The front counter should be calm, quiet, and relaxing. Auditory and visual contact with dogs should be minimized. Waiting areas should have chairs, benches, shelving, so cat carriers don't have to be placed on the floor. Low-stress areas should also allow cats to avoid visual contact with each other. A cover or visual barrier should be placed over a cat's cage. Towels, sheets, or other coverings can provide this. If cats feel hidden, they tend to have less stress. Feline facial pheromones, or FFPs, sprayed on the covering may also decrease stress. These chemicals trigger a social or sexual response that is species-specific and can reduce stress. A study on FFPs at The Ohio State University showed that FFPs helped calm some cats who, after exposure, showed increased facial rubbing, grooming, walking, and an increased interest in food. Relaxing background music can also help minimize stress. It should not, however, be played all day, since cats do require several hours of quiet each day. An important component of low-stress handling is the timely handling of arriving animals. If we can decrease the crowding and wait time, overstimulation may be able to be avoided. Unsocialized cats are at a great danger for stress since they are not used to interacting with people. The highest priority animals should be handled first. The fearful, fractious, stressed cats, but because they can be more challenging, staff often put these guys off until the end, which just makes everything worse. An understanding of cats and their fears is key to low-stress handling. Cats are social within their colonies. They typically avoid fights and often distance themselves from other cats and respond to confrontations by hiding. Cats may perceive predation throughout the veterinary facility. The ability to hide is a coping mechanism. Providing a cover or visual barrier in the form of a towel, sheet, or other covering can greatly decrease a cat's stress level. Many cats don't like to be touched. Tactile communication with other cats is often reserved for members of their social group or colony. Rubbing or allogrooming, which is licking another cat's head and neck, are common within a cat colony. Here you can see two of my kittens giving each other a bath, and most cats prefer being touched in the head or neck area. Low-stress handling includes thoughtful cage placement. Cats should have a hiding place. Their litter box should be placed separate from their food and water. They should also have room for a bed. The ward should provide a time with lower light, since light 24/7 can increase their stress level. In an outpatient setting, it is important that cats are not dragged out of their carriers, placed on a cold, hard exam table, and poked and prodded. Carriers that have tops that lift off or openings in the tops are much better than ones that require the cat be physically removed from it for an exam to occur. Towels to cover the cat's head can help decrease its stress, as can a towel or yoga mat placed on the exam table. Table scales with sides are far less stressful than flat stainless scales, and things should be done as efficiently as possible to avoid overhandling. Treats can be used to distract the cat. Freeze-dried liver, canned spray cheese, baby food, and tuna are all options. Handling the cat should include light, gentle restraint. The adage, "the best restraint is the least restraint," is true, and restraint should be tailored to the individual and the procedures to be performed. Preparation is key. There is less stress when we do things efficiently. The handler should move slowly and calmly and minimize direct eye contact, since that can be perceived as a threat. A quiet, calm voice can make a big difference in handling a cat. Once a cat is stressed and overstimulated, it can have a prolonged reactive time. Scruffing should be avoided and should not be the main technique for restraint. Low-stress handling should include restraint with a towel, hand on the chest or nape, and allowing the cat to hide its head in the crook of one's arm. It is very important that staff not get angry with the animal, since this too can cause the cat to be more reactive. We need to remember that there are many stressors in a hospital environment. These include other animals and humans, noise, smells and odors, no place to hide, unfamiliar caretakers, unfamiliar food, and an unfamiliar routine, as well as sensory overload. The summation of all these things can equal a stressed cat. Excessive stress can mimic disease states, and stressed cats often appear to be sick. Excessive stress can mimic disease states, and stressed cats often have an increased heart rate, increased respiratory rate, dilated pupils, increased body temperature, and increased blood pressure. Fear and stress can also cause abnormalities in white cell lines and blood glucose levels, which can not only mimic a sick cat, but can cause a sick cat. Treating a cat in a low-stress way should include using the least invasive method to treat, giving medications in different routes, warming injections, and using new sharp needles. Preemptive chemical restraint can be an important component of low-stress handling. A holistic approach to stress reduction should include consistency, vaccination as close to admittance as possible to allow sufficient time for an immune response, and quiet, compassionate, respectful handling. A soft e-collar or bandage, a yoga mat to allow a firm grip on an exam table, and a hiding place can all make huge differences in a cat's overall life quality. Low-stress handling is a holistic approach filled with positive interactions, and we need to remember that decreased cat stress equals decreased staff stress. Here's a list of the resources that I used for this presentation. If you have any questions or comment, please feel free to contact me.